Hey everyone, today I'll be talking about rheumatoid arthritis. Rheumatoid arthritis is defined as an autoimmune inflammatory disorder of the joints. But remember, it can also have extra-articular manifestations. The exact cause or the etiology of rheumatoid arthritis is not known, but it can have a strong genetic association. Also, it can be associated with certain infections such as the Epstein-Barr virus. A patient of rheumatoid arthritis can complain of joint pain. Also, he or she can complain of stiffness of the affected joint. Do remember that this stiffness is more during morning. Rheumatoid arthritis usually affects the small joints of the body. For example, it can affect the wrist joint, or it can affect the metacarpophalangeal joint, or it can affect the proximal interphalangeal joint. As I've already mentioned, rheumatoid arthritis can have extra-articular manifestations. For example, it can have ocular manifestations wherein patient can present with complaints related to conjunctivitis. Also, it can affect the individual's lung, wherein the individual can present with complaints related to interstitial lung diseases. It can also affect the cardiovascular system, wherein patient can present with complaints related to chronic mitral regurgitation. Now, I need you to remember something special that is known as Felty's syndrome. And this is a triad of rheumatoid arthritis, enlarged spleen, that is splenomegaly, and altered neutrophil counts, that is neutropenia. In order to confirm your diagnosis, you need to go for certain investigations. Rheumatoid arthritis has a few peculiar radiological findings. For example, there is reduction of joint space. Also, there can be erosion of the articular margins. There can be subchondral cyst. Also, there can be juxta-articular rarefaction. Apart from radiological investigations, you can go for certain blood investigations, such as you can go for the levels of ESR and C-reactive proteins, or you can go for levels of rheumatoid factor. After establishing a diagnosis of rheumatoid arthritis, you need to go for its treatment. And the first line of treatment is always a medical management, wherein we can give drugs known as DMARDs, that is disease-modifying anti-rheumatoid drugs. It includes drugs like methotrexate, hydroxychloroquine, sulfasalazine, and leflunomide. Apart from DMARDs, you can also go for monoclonal antibodies, and in severe cases, you need to go for surgical management. So, this was all about rheumatoid arthritis in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Also, you can check out my videos on osteoarthritis and YouTube short on how to differentiate between osteoarthritis and rheumatoid arthritis. Thank you.